Hello, everyone. Jason Wisniewski from JW Senior Insurance coming back at you with another video today. And today's topic is going to be a topic that I've never really felt the need to discuss much in my 17 years of doing this in the Medicare industry, but just seeing some of the ridiculous propaganda out there floating on the internet from some pretty suspect sources, I'm going to address the issue head on here. Um, Medicare Advantage and prior authorizations. So I've seen, every now and then you'll see an article, usually from a source that has kind of an agenda, either a far radical left wing publication or something from an agent or broker who may only sell one type of plan. Maybe they only sell Medigap supplement plans, and they may do that for various reasons that I can get into later here. But I just want to address this issue head on about Medicare Advantage plans and prior authorization. And I'm going to preface this with I have sold Medicare Advantage plans a majority of my clients for the last 17 years. So that is all of my Medicare insurance career. Um, and I started my career um, before I went independent as an agent with United Healthcare. I did telesales in 50 different states. So I've been licensed in all 50 states across the country at one point. So I have done this for a very long time, and I was originally got into this business when Part D was brand new. That was 2006, and Medicare Advantage was improved from the previous incarnation. So I have seen these plans grow and grow over the years to where, there was maybe 15% of people with Medicare had them, to now it's over 50% of Medicare beneficiaries on Medicare Advantage plans. So let's just get to the heart of the issue here about prior authorization and the scare tactics that are used about it. It really has no basis. And these are statistics, these are official statistics from Medicare. Medicare Advantage plans approve 94% of prior authorization requests on the first request. So you can see a headline that says Medicare Advantage plans deny authorization requests. And that, until you read the fine print, that's 6% of authorization requests. Converse that with my video headline, Medicare Advantage plans approve 94% of prior authorizations. When you read that, it doesn't really seem like a problem now, does it? It's all in the headlines. And of the 6% that are denied, over 80% of those denials are approved on first appeal. So this is really just a non-issue with the program overall. And further, it says here, less than 50% of Medicare Advantage enrollees have ever even needed prior authorization. And I can tell you, I've not really encountered anything where it has been a problem to get some sort of major work done with any of my clients. My clients have gone through chemotherapy, cancer, have had surgeries, hospital stays, open heart surgery. I've had family with Medicare Advantage that's had 3 open heart surgeries. There was never a problem getting that approved, and those are not even the types of things that even the articles are complaining about. It's more when you're going to run into this. It's, do you need this MRI really? Um, is there a different way to treat this? And usually they'll ask the provider that, and maybe that, you know, puts 2 or 3 days onto the wait before you're approved. Or maybe that you have to take it's a step therapy and you have to do some certain tests before they'll approve another type of test. But it's never a case of you have to get prior authorization in an emergency, you're having a heart attack. There's no such thing as that in Medicare Advantage or any kind of Medicare plan. And anyone who tells you differently is lying and fear mongering. That just does not exist. It's not even legal under the Medicare guidelines. So that is not even happening. And only 6% of Medicare Advantage enrollees that were surveyed have said that they even go through prior authorization often, and over 66% said it has absolutely no burden on their care. And furthermore, it's not like it's not like you never need prior authorization with original Medicare or Medicare with a supplement. You do. You need prior authorization for durable medical equipment, wheelchairs, oxygen, CPAP machines. Those have to get approved now with Medicare, original Medicare. And to put this in further perspective, 0.0001% of Medicare Advantage enrollees have had a disputed prior authorization denial for medically necessary care. So it's just not happening on any kind of relevant scale at all. And furthermore, many of these prior authorizations, a lot of these simple ones, are going to be auto-approved within the next 2 years. There's new legislation that is moving towards that. So this is not even going to be a talking point anymore by 2026. But I just want to address it now so that there's not unnecessary fear-mongering going on here during the Medicare annual enrollment period. Because it's just ridiculous. Overall, surveys show in Medicare Advantage that 90% of Medicare Advantage enrollees are in a plan with a 4-star or higher rating from the Centers for Medicare and Medicaid Services. So that's customer service rating, health plan quality, access to prescription drug coverage. Those are 4 stars or higher. And if you look in the back of the Medicare and You book, any book that you get, when you look at the Medicare health plans, those are the Medicare Advantage plans, you'll notice that their star ratings from the customer satisfaction are higher than the standalone drug plans that people with original Medicare have. Because the Medicare Advantage drug coverage is generally better than a standalone drug plan. And 94.9% of all Medicare Advantage enrollees are satisfied with their plans according to official surveys. 95.6% are satisfied with ease of access to doctors and networks. There's many more PPO plans available. And there are even open access HMO plans with point of service benefits for some out-of-network coverage, as well as open access plans that are HMOs that don't even require a referral. In my home state of New Jersey, there is no Medicare HMO that requires a referral in the entire state. I think people that stereotype this are thinking this is an HMO plan from the 1950s, and it's just not. I mean, times have changed. This is just not even a thing anymore in most cases. So 93.6% have a usual source of care or a primary care physician. The average Medicare Advantage beneficiary saves, on average per year, $1,965 savings versus enrollees in original Medicare. They also have lower hospitalization rates, lower readmissions to hospitals, a higher rate of preventive care and screenings than original Medicare, because Medicare Advantage plans will encourage you to get those screenings. They even give you reward incentives to get them. You actually make money getting your preventive screenings. They cover an annual physical every year, a real physical, not the silly Medicare wellness exam where they don't even draw blood, but an actual, real, legitimate physical exam. Who would know that preventive care and detecting things early would lead to better outcomes, obviously. And Medicare Advantage also performed better in COVID-19 mortality rates during the pandemic than original Medicare. So all this fear mongering out there, it's just ridiculous. Um, and the people who try to paint false narratives, to say, oh well, the broker gets paid more to sign someone up for Medicare Advantage. That's simply not true. A broker only makes a higher commission on a Medicare Advantage plan than a Medicare supplement plan if the person is brand new to Medicare, just turning 65 or going on Medicare for the first time. They don't make more when somebody is just switching from one plan to another. And even if someone is brand new to Medicare, if you just sell them a Medicare Advantage plan, that's one plan commission. But if you're selling them a Medicare supplement plan, a prescription drug plan, a dental plan, a vision plan, a hearing plan, all these different plans, by the time you're done, you're making more money selling multiple plans. So that just falls flat on its face. It's just ridiculous. And I think a lot of the people that push this stuff are people that sell only one type of plan. They just sell Medigap plans. That's maybe what they started selling. Maybe they've been in the business for, twice as long as I have, but they never familiarized themselves with Medicare Advantage, and they just demonize it to try to get more Medigap supplement sales. It's also less of a pain in the ass for a broker to learn more plans. They don't want to sell plans that have drug coverage. A lot of them, they'll sell you a supplement plan and then they'll refer you to Medicare.gov to buy your drug plan because they don't want to deal with the coverage gap or the donut hole, or trying to help people apply for extra assistance to get help with their medications, because they don't want to get they don't that's where the complaints come from, when people complain about their drug costs. And so these agents don't want anything to do with it. So they're afraid to sell these other types of plans. They don't want to spend the time looking up all the medications or looking up the doctors, because it takes long. It's time consuming. If somebody has 10 doctors and 13 medications to look up, it's much easier to just sell them a Medicare supplement and say, oh, you can call 1-800-Medicare to get your drug plan. So, spare me with the BS about Medicare Advantage. These plans are excellent plans. Are they a fit for every single person with Medicare? No. But to say that nobody should sign up for them is just ridiculous. It's absolutely ludicrous and insane. Number one, not everyone qualifies for a Medicare supplement. How can you give somebody that advice? That is completely unprofessional. Many people that are under 65 and on disability can't get a Medicare supplement in their state. It's not even legal to sell them one. And if they're on Medicaid, the only type of plan they can get is a dual special needs plan, which is a Medicare Advantage plan. You can't sell them a supplement. It's illegal. Also, people with pre-existing conditions, there's medical underwriting to get a Medigap policy. Everyone is accepted for Medicare Advantage. Should those people just sit on original Medicare and expose themselves to 20% coinsurance with no out-of-pocket maximum? That's the worst advice you could give somebody. The correct advice is you should choose a plan that fits your needs. That's why when we sit down with our clients, we make sure their doctors accept the plan that they want, that has the benefits they need, and they can afford it, and they qualify for it. To go around broad brushing a program that over half of Medicare enrollees are on is just ludicrous. So it's just amazing that I even had to make this video, but I'm seeing so much BS and fear mongering and propaganda out there that I just felt the need to make this video to dispel and debunk some of the misinformation out there that may be unnecessarily scaring people. What you should do is do your own research. Contact a trusted broker. Whoever that may be in your local area. Local brokers are usually going to be the best because they know the market in your area the best. If you're in New Jersey, of course, yeah, I may be biased, but I have a 5-star rating on Google and Facebook from my customers. I've done this for 17 years. I certify with 9 different carriers every year to offer my clients the right plan for them. And whether that's Medicare Advantage or Medigap, that's going to be determined by the client. I'm not going to sit here and pretend that there is one best plan for everyone, because that's just a completely false narrative. But I hope this was informative for you guys about Medicare Advantage plans with 94% approval rate on prior authorizations. Don't be afraid of Medicare Advantage. It's not the devil. Okay, far from it. It can save you a lot of money, and it saves most people a lot of money. So, if you guys want more information on our services, of course, check us out on the web, www.jwseniorinsurance.com, and we will see you guys on the next one. Take care.